So next we have what is called the surgical safety checklist, which was promoted by the World Health Organization, and you see there's 3 different columns. At my hospital we actually have each column printed on large posters, so we're going to make sure we haven't missed one of the steps. So this is a more condensed version. I've used the adjusted version for obstetric patients. So we checked the patient's identifiers again, the consent, what procedure we're doing. In this case, has there been a CTG done on the fetus, allergies, are they wearing checks, and is the surgery available? So the anaesthetist confirms that the equipment is checked and appropriate, and if it's indicated, is there a difficult airway, or maybe there's an aspiration risk, are there warmers in place to prevent hypothermia? Okay. Now, it says on the side, in the category 1, which is an emergency, these things will be checked during timeout to save time. Then the good old timeout, which happens before the procedure starts, and a knife goes to skin. Yep. And again, all team members make sure that they know each other, at least by name and their role. And then there's a whole list of verifications being made: patient, procedure, indication, gestation, fetal risk, maternal risk, special equipment available, the anaesthetist verifies, antibiotics, IV access, blood, and the scout scrub verifies the consent matches, and the sterile instruments are confirmed to be sterile, and we're ready to go. So after the procedure finishes, we do a sign out. So the surgeon verifies that what he just performed is similar to the procedure that was recorded in the consent. The scrub scout nurses do a final count, make sure all the specimens, if there are any, are correct and correctly labeled. If there were any equipment problems, that they were addressed and flagged and lodged. All team members discuss key concerns, airway concerns, estimated blood loss, need and timing for post-op labs and imaging, and then everyone signs.